Director. Good evening. It's good evening to the listening public out there. Good evening to our Honorable Minister of Health, who maybe is listening to this press conference at this time. Since the passage of Tropical Storm Erika, the Ministry of Health has activated its emergency response plan. One of the things that I would like to reassure the general public is that we are operating. We have done a quick assessment in terms of our healthcare facilities, and the details of those healthcare facilities in terms of how operational they are will be provided by the Director of Primary Healthcare. But just to say from start that our main hospital was not directly affected, so our main hospital is fully functional. We have a complete assessment in terms of all of our 52 health centers, which ones are functioning and which ones have been affected. We were able to do as well a rapid assessment in terms of our staff, which ones of our staff that were directly affected by the passage of the storm. And based on that assessment, we were able to come up with a needs assessment in terms of requesting for additional support outside of Dominica. In terms of our response, a lot of our response are focused in terms of the areas which have been identified as the special disaster areas, as indicated by the Prime Minister. Those areas which involve Bath Estate, Paradise Valley, Pilisavan, Campbell, Pishley, Pilisufria, Good Hope, San Sever. We have gotten a number of assistance in terms of regional assistance to complement the staff that we have in Dominica to assist us. We have gotten assistance from Cuba. We have on island additional anesthesiologists, pathologists, several other nurses from different countries, and Dr. Blah will speak to the details of those. One of the things that we have done is to determine what exactly the quantity of medical supplies that we had on island in terms of our drugs and medical supply, and based on that, we came up with a list which was immediately submitted. I must say that immediately after having submitted that list, we were able to get a lot of the medications in terms of life-saving medications which we didn't have on island to complement what we have in Dominica. We have a significant amount of medical supplies that are currently coming in. We are taking an inventory of those. As soon as these supplies come in, we're ensuring that these supplies are distributed urgently to the communities in which they are needed. In terms of our response as well, we have activated a surveillance system have been activated. We are monitoring what is happening in the community in terms of diseases, in terms of injuries, in terms of our water and sanitation and our vector-borne diseases. Part of the Ministry of Health response is the whole question of mental health response in terms of providing emotional and psychological support for the persons who have been directly affected by the storm, and that is ongoing as we speak. Some of the concerns that we have in terms of following the storm in terms of waterborne diseases, particularly gastroenteritis, and our director will speak specifically in terms of some of the do's and don'ts in ensuring that persons do not get waterborne diseases. We also have concerns in terms of vector-borne diseases such as leptospirosis spread by rats and other types of animals. And again, the director will pay special attention in terms of some of the things that we need to do to address that. We have, as part of our response, mindful of our patients, and we have immediately done what you call categorize our patients in terms of some high-risk patients. So we have identified patients who are high risk in terms of our patients whose condition may be compromised if they do not seek medical attention within 24 hours, such as our dialysis patients who are dialyzed 2 to 3 times, sometimes 3 times a week, our diabetic, our hypertensive patients with heart diseases, and we have a plan in terms of addressing it. So in a nutshell, just to say that the healthcare service is functioning with some limitation. We are supplying medication and other essential medical supplies to the communities. We are getting an outpouring of donations, and one of the things that we have set up a policy in terms of what type of donations that we're expecting. We're expecting persons in the regional and international communities that are in supplying medication or drug supplies to Dominica will be mindful in terms of the type of drugs that we are requesting, the expiry date of those drugs that we are requesting. I want to say that in terms of our response, we, as Pierre said, we have set up a health emergency operating center at the Princess Margaret Hospital. We report on a real-time basis to our representative that is present on a 24-hour basis operating at the National Emergency Operating Center, and we get feedback, and based on those feedback, we modify our response. Thank you very much.